Hi everybody, Dr. Anjana Bana here and welcome back to my YouTube video. Today we are going to be doing two treatments, both involving relaxing fine lines. So one is an Argibenone treatment. Argibenone is, I'll tell you a little bit more about it later, but it's this little injectable serum that helps smooth lines, like dynamic lines, without injecting Botox, and also builds tissue because it's got a coenzyme Q10 in it. So it's an antioxidant that helps with under eye hollowness as well as dark circles, although you can use it wherever you have skin. It's a really nice regenerative treatment with peptides as well as coenzymes. And we're going to do our traditional botulinum toxin treatment for dynamic lines in the frown and forehead, and we're treating my husband. So we're going to start with the under eye treatment. I've already drawn it up. We're going to use a cannula to inject it almost like a filler. So even though this is safe and it's not a filler, you have to be judicious and inject little bits at a time. This treatment you can repeat, so between 1 and 3 months. I like using a cannula for the under eye, so let's just this way. But this will also improve the skin quality. Another treatment that would really be nice here would be a PRF or PRP treatment for the under eye. So you can see it's a very viscous solution. We're just going to make an entry point, so you might feel a little poke, sorry. Relax that.
So why are you only allowed to use 0.5 or 1?
So the same with fillers. Even though this is not a cross-linked hyaluronic acid, putting too much of something in can put pressure on the lymphatics, on the venous system around the eyes, and you can have some congestion and swelling. Yeah. So this is a good alternative for patients that can't or are nervous about doing under eye filler. Obviously, because of the hyaluronic acid, you do expect some swelling. Today it goes away. Another issue with under eye filler, besides the swelling, is something called Tyndall effect. So Tyndall is a blue-gray discoloration under the skin. So, and as soon as you dissolve, that disappears. Sorry, love. Sorry. From 2 weeks onwards, you'll start getting an improvement, and then we'll see in a month or so. So surface treatments like normal chemical peels would also be nice to do, and an eye cream and some sunscreen. You are not wearing your sunscreen, but yes, that would also be nice to just maintain the treatment. So now we're going to do your Botox. So Botox now is different from this whole Argibenone that we just placed under the eye. So if you smile for me, smile. So you do definitely have a bit of crow's feet. We're treating this with botulinum toxin. So if you look across for me, if you frown, so a strong frown, you know, worry, anxiousness, you might look more angry or stern. So it would be nice to relax that area, and then also it opens up the eyes. So that was the first area of cosmetically to be FDA approved. The other area is the forehead. So if you lift your forehead, also, you know, surprise and worry might be associated with this. But with foreheads, especially male foreheads, you have to be very careful, because the forehead is the only muscle in the upper face that lifts the brows. And then if you do this, I can move my forehead. So if you move your forehead, and you can see so if you lift and lower, so you can see that one part of this frontalis muscle, this forehead muscle, when you lift is pulling the hairline down and then raising the brows. So it's important to try and stay above something called the C line. The C line is somewhere here. I'll mark it off now. So if you raise your brows again, babe. So there. So above this C line, it's pulling the hairline down, and below the C line, it's raising the brows. Also, one thing I have to be careful with, especially in my husband, is something called Mephisto effect. So that is under-treating the lateral or the sides of this frontalis muscle, and then you get like a very sharp brow, like they call it Spock brow or Mephisto. And I mean, that can be, that can be corrected though at follow-up. So if you have a botulinum toxin patient, it's important that they come for a follow-up appointment. So if you raise your brows up for me, so, yeah. Okay, and then usually above the C line, the injections are into the muscle, deeper injections, and then below the C line, if there are some areas of concern, it's better that it's intradermal. I know there's some controversy about intradermal injections and immune response, like is that what leads to toxin resistance? It's okay if you raise your brows up again. Okay, and then if you look cross for me, look cross again, like super cross. Okay. And this is the distraction device. You can hold it here. It's true you got it for a week. You can relax. Often men, because the muscle may be more hypertrophic and more active, may need a higher dose. The forehead, the movement comes back before maybe the frown. The doses that are used in the forehead can't be as high as these glabellar muscles.
Mm-hmm.
So it's just a bit swollen under the eye.
You see?
Okay. Measure. All right, we have just completed our Argibenone treatment, our under-eye Argibenone treatment. So there is a bit of puffiness, some swelling, so that's to be expected. It'll settle down between today and tomorrow. And we also did a botulinum toxin treatment for the frown and frontalis muscles. So there's those little bumps that'll go away in about 15 to 20 minutes. And then I will check on you obviously later and make sure you're following post-operative instructions which you've been given. So basically not to touch the face, not very hot showers, no washing your hair today, especially with the botulinum toxin, no exercise today either, and no helmets, hard headgear, like pressure in that area, because where we injected it was, the depth and the area is, predetermined, it's very precise, and we don't want any squeezing or that botulinum toxin to move where we don't want it to move. So thanks guys once again for joining me on this video. If you have any questions, drop them in the comments down below. Like, share and subscribe. Bye.